What's the first sign of paralysis?
Anal tone.
Stick your finger up his ass.
Charming, unconventional, arrogant are often the words to describe the so-called best doctor ever on the TV show The Resident. Today, we're going to be breaking down and reviewing all of the unconventional medicine that this medical drama has to offer. But before we get into it, if you are new to my channel, welcome. My name is Dr. Jordan Wagner. I'm an ER doctor. If you enjoy the educational reaction videos and other stuff you see here on this channel, please smash that subscribe button and turn your bell notifications on. That way you learn when I post a new video. Also, thank you to Stoggles for sponsoring today's video. Let's dive right in. All right, we're in the OR.
Bill, yank that sucker so we can get out of here.
These guys are wearing PPE, so personal protective equipment. Basically, that is an umbrella for like a gown, gloves, mask, a hat, basically headwear and eyewear. Depending on your hospital, sometimes they will provide your PPE. Most of the time they cover the basics, but for myself, I want something that's comfortable and fits my face. So I actually use Stoggles because they have these clear sides and a top shield that protect my eyes, but they also don't block my peripheral vision. So if you're a doctor, nurse, work in healthcare, dental office, and you need any of these protective eyewears, I got the hookup. Use the code DrER10 for 10% off, but make sure you use the code link that's in the description below.
No, the appendix hasn't burst. That's good news.
The risk with appendix getting infected is as it gets infected, it swells, and then actually can rupture, and then you have fecal material within the abdominal cavity.
Slippery little fellow.
Did you guys know this is my first surgery, Dr. Bell?
No kidding. I have to get a photo. Make it quick.
Get in, Chew.
It is totally inappropriate. Go back to your stations.
Yeah, definitely inappropriate to take photos like that. Could potentially violate like a HIPAA violation. Unless you have consent to be able to get photos by the patient, you shouldn't be doing that. Oh, whoa!
I was waking up. I need to up the SIBO.
Oh my God. You hit an artery?
Whoa, okay. Because of where the hand was, it looks like an arterial laceration, and now you gotta get control of it, find it, and sew it back together.
And call for 4 units of blood and 2 FFP stack and give them each a Dellenberg.
You know, get the blood, get fluids, get FFP. So FFP means fresh frozen plasma. You're giving blood back to the patient, right? So they're losing it pretty quick, so you want to give it back. They always have blood ready during operations for people, so in case emergencies do happen.
Packing section.
You have to clamp something. He's lost at least 2 liters already.
Lost 2 liters. We have like 5 liters, about 10 pints of blood in our body. So that's a lot. That's more than a third of your blood. You're definitely gonna become hypotensive, tachycardia, go into shock.
We just lost a pulse PA arrest.
Pressure, Cheryl. I'm starting compression.
Oh my gosh, okay. I love TV CPR. So they lost pulses, so the patient's heart stopped. So you have no more pulse. So then he went into what they called PEA arrest. So it's called pulseless electrical activity. So meaning on the monitor, you're seeing what looks like an EKG, but there's no pulse. So the heart is getting the normal electricity that our body produces, but it's not actually pumping anything. Immediately, you start CPR.
CPR isn't going to put all that blood back into his body.
Dying on me. Well, I think we can all agree it was the misdosed SIBO that led this unfortunate situation.
What?
You're kidding, right?
The patient woke up. His arm hit my hand.
Wow. It's tough in these situations. You're like placing blame. So what the doctor is saying is the SIBO, which is basically a type of gas that's a sedative, he's talking to the anesthesiologist and saying, you screwed up. You inappropriately dosed him and he moved. And my blade was in the field. I lacerated because of the movement of the patient, not because I did it. He did then discuss INRs. INR is a type of blood test relating to coagulation. So they're saying upper limit of normal. So if it is a little bit higher, you have a little bit more increased risk of bleeding, having to do with it blocking one of the factors within the coagulation cascade.
You know where I can find Dr. Conrad Hawkins?
Namaste.
Oh, shh.
Found him.
Nice.
Take off that tie. You're not at Harvard anymore.
So I used to be a teaching attending for Harvard University Hospital. So I've never worn a tie when I worked at the hospital because it can be used against me. It's just dangerous. And it's also a fomite. It can harbor bacteria and then it falls on patients and it's just not a good situation. So we don't need ties.
Yeah, severe cauda equina syndrome. What are we worried about?
Early paralysis.
Hey, man. What's the first sign of paralysis?
Anal tone.
Stick your finger up his ass.
Ah, the good old days of being a resident or a medical student. So, cauda equina syndrome, the end of your spinal cord is called the cauda equina. It just has to do with compression.
An MRI would take hours and delay steroid treatment and surgery, both of which might save Doboslav. A loose rectum means his legs may give out soon. Tight means there's no paralysis, so we need to know exactly how tight it is up there.
And those nerves have to deal with innervating around your anus. And so to test to make sure that it's not fully compromised, you check for rectal tone. The only way to check for rectal tone is to stick your finger up someone's anus and basically contractions to make sure the muscle is working.
21-year-old girl, history of IV drug use.
It could be methamphetamines, opiates, any other street drugs that are out there.
Likely endo.
He said endo, so endocarditis. So endocarditis, an infection within the heart itself. And typically it's on the leaflets or the valves of your heart, which then can throw septic emboli, and there's specific bacteria that are related to IV drug abusers that end up getting endocarditis. So treated with antibiotics. In this situation, you may need to strap the patient down to the bed, give a type of sedative so everybody can save her life.
See, these are Osler's nodes. Caused by bacteria swarming in your blood and moving throughout your body. Classic for endocarditis, an infection of the heart valve. Happens to drug users all the time. If you walk out of here without any antibiotics, this will kill you.
Osler's nodes and Janeway lesions. These are findings on your skin related to infective endocarditis. He's right? If you don't get treatment appropriately for endocarditis, you could potentially die.
I'll stay if you give me 3 milligrams of Dilaudid.
2.
Nope.
You calm down and you get back in bed right now.
Dilaudid is one of the opiate medications that we have in the emergency department. So she wants 3 milligrams that would kill a horse. He offered 2. We don't want to just barter with a patient to get them to do what we want them to do. But if it's going to save somebody's life, to keep them in the hospital, you got to do what you have to do to make that happen.
Baby!
Collapse to the ground, check for pulse, check for breathing. No pulse, defibrillator if you can, start compression, start rescue breathing.
You're running the code.
I've never run a code.
Do you want an amp bicarb? He's in charge. Page anesthesia.
Oh man, put the book down.
That's the code.
Rhythm. What's rhythm?
PEA. Should we shock?
No, we can't. A rhythm's not shockable. Get me one of Epi.
He's looking at a rhythm because is the patient in a shockable rhythm, which is VFib or VTAC? Is the patient in asystole, which is flatline, or are they in PEA, pulseless electrical activity? That monitor actually showed asystole.
24 minutes, it's time to call the code.
No,
Come on,
this is my
CPR.
code. You gave me this code. She's 21 years old.
In-hospital cardiac arrests have the best chance for survival. 24 minutes and the body hasn't responded, code is stopped, and you actually pronounce somebody dead. But then you also have to realize the body is not beating anymore. The heart's not beating, it's not getting oxygen perfusion, the blood's not flowing as well as it should. So then you're not getting the appropriate functions of the body occurring, so things are just getting worse and worse.
You saved her life. Her end tidal CO2 is less than 15 for the entire code.
That doesn't necessarily mean that...
Yes, it does. She's been without oxygen to her brain for 26 minutes. Congratulations, you got her heart beating again, but she's brain dead.
The issue with a prolonged CPR and resuscitation, if somebody is healthy, you have a higher chance of getting their healthy body back, but then do you want that person to be back in the situation where now they are brain dead?
We pushed adenosine 6 milligrams, then 12. She's still tacking away at 180.
This lady was given adenosine. Adenosine stops your heart for a few seconds. So SVT means that the electrical impulse is coming from above the ventricle, supraventricular tachycardia. So you're trying to reset it so then it can go down its normal pathway. He's going to get ice so he can throw ice on her to try to shock. It has to do with the baroreceptors within your carotids. Boom! It works! Boom! Hey, look at the monitor. You can also do carotid massage as well. And so there are different mechanisms to be able to try to get this to work. I literally deal with this probably at least once a week where somebody comes in SVT. A lot of times the paramedics are really good at picking this up and they can even give adenosine in their ambulance. where you're seeing all the plastic in his hand, that's actually the wires. The steps of the procedure are a little different. They're not correct here.
Of human ingenuity and cutting-edge technology, man and machine are melded, working as one.
Totally appropriate. Didn't want to, he knew he'd screw up. So anyways, this is awesome. I love this. This is like a day in the life of what I do every day. And this is probably better, definitely better than Scrubs in relating to the medicine. So I really love this. If you guys love this, let me know if you want me to do more of these resident react videos. And as always, subscribe, turn your bell notifications on, like the videos. And if you really like this one, check out this video. I know you'll really like it. Thank you for watching and stay healthy, my friends.